What is mental health? Mental health includes our emotional, psychological, and social well-being. It affects how we think, feel, and age. It also helps determine how we handle stress, relate to others, and make healthy choices. Mental health is important at every stage of life, from childhood and adults can through adulthood. Although the terms are often used interchangeably for mental health and mental illness are not the same. A person can experience for mental health and not be diagnosed with a mental illness. Likewise, a person diagnosed with a mental illness can experience period of physical, mental, and social well-being. Can your mental health change over time? Yes, it's important to remember that a person mental health can change over time depending on many factors. When the demands placed on a person exceed their resource and coping abilities, their mental their mental health could be impaired. For example, if someone working long hours, caring for a relative, of experiencing economic hardship, they might experience poor mental health. Four most common mental disorder. First one, anxiety disorder. 2. Mood disorder. 3. Psychotic disorder. 4. Eating disorder. Anxiety disorder. The most common category of mental health disorder in America affects approximately 40 million adults 13 and older. Anxiety disorder causes people to experience distressing and frequent fear and apprehension. While many experience this feeling, say during a job interview or public speaking event, as that can be a normal response to stress. Those with anxiety disorder feel them commonly and in typically non-stressful events. And bouts of anxiety can last up to 6 months or more at a time. Anxiety is actually a blanket term that includes a host of specific disorders including mood disorder. An estimated 1 in 10 adults suffers from some type of mood disorder. While it's normal to experience mood swings from time to time, people with mood disorder live with more persistent and severe symptoms that can disrupt their daily life. Depending on the specific disorder, people may experience an ongoing state anxious or empathy, mood, feeling of helplessness, low self-esteem, excessive guilt, decreased energy, and more. Therapy, antidepressant, and self-care can help treat mood disorder. The, the, the most common mood disorder are psychotic disorder. Thus, suffering from psychotic disorder might be unable to know what is real and what is not. This group of mental disorder shares an individual sense of reality. Scientists believe that certain virus problem with no specific brain circuits work. Extreme stress of trauma and some form of drug abuse might play a role in the development of psychotic disorder. The most common psychotic disorder include eating disorder. Eating disorder are about more than an individual relationship with food. They are complex mental disorders that often require intervention from medical and psychological experts. These conditions cause unhealthy eating habits to develop, such as an obsession with food, body weight, or body shape. In several cases, eating disorder can have serious health consequences and might even result in death if left untreated. Common symptoms include the severe restriction of food buying or purging behaviors, such as vomiting or overeating. The most common type of eating disorder include what causes mental illness? There is no single cause for mental illness. A number of factors can contribute to risks for mental illness, such as early adverse life experiences, such as trauma or a history of abuse. For example, child abuse, sexual assault, witnessing violence, etc. Experience related to other ongoing chronic medical condition such as cancer of diabetes. Biological factor of chemical imbalance in the brain, use of alcohol or drugs, having feeling of loneliness or isolation.